Hi, today we're going to be looking at diagnostic, therapeutic, and allied health professional salaries and career pathing in South Africa. I'm Manithan Ryan, a medical doctor with more than 20 years of experience in the healthcare industry. So join me as we look at these career pathings and salaries. In 2009, the occupational specific dispensation for diagnostic, therapeutic, and allied health professionals came into play, and the salaries and career pathing was negotiated upon. So we're going to be looking at 24 jobs today that fall under the diagnostic, therapeutic, and allied health professionals. It ranges from dietitian, nutritionalists, physiotherapists, occupational therapists. As the list goes down, you can see dispensing optician. To the right, we see a biokinetist, speech therapist, dental technician, speech therapist, and audiologist, right down to occupational hygienist and an oral hygienist. The career pathing has been divided into a general stream, a policy development stream, and a program coordinator stream. So you initially do your community service and then move on to a grade 1, 2, and 3. Thereafter, you can take on a chief position as a chief dietitian, chief physiotherapist, and so on. This is 2 grades, grade 1 and grade 2. You can also take up a position of assistant director, which is grade 1 and grade 2. The chief is usually seen in district hospitals, and assistant directors are usually seen at regional, and deputy directors in tertiary hospitals. The policy developers and the program coordinators are district and head office positions. So after 3 years experience as a physiotherapist, occupational therapist, or dietitian, you can move on to a grade 1 policy developer. The salaries for the chief, policy, and program coordinators are all the same, as well as the assistant directors in these 3 categories are the same. As I said, these are head office positions or district office positions, while this is institute-based positions. To move from a grade 1 to a grade 2, you need 10 years of experience, and from grade 2 to grade 3, you need a further 10 years of experience. With a chief, assistant director, and deputy director, you need 3 years of experience. Thereafter, you can take up the post as grade 1. Grade 2 is not an advertised post. You work in your grade 1 position and then move on to grade 2. This is after 8 years. So let's move on to the components of the salary. So the deputy director level is based on a total cost to employer package. That means 70% of your salary is a basic salary and the other 30% is structured to your needs. All other levels are based on a notch or basic salary with the following additional benefits. That means you can get a housing, you can get medical aid, you get a birthday bonus, standby allowance, and the employer contribution to pension. The rural and PSCBC rural allowance are 12 and 17%. According to Resolution 2 of 2004, the Public Health and Welfare Bargaining Sector Council, the following staff categories are eligible for these allowances: dental technician, dietitian and nutritionist, physiotherapists, occupational therapists, radiographers, and speech therapists. Let's look at the salaries now. So the salaries we're going to discuss is the same for all diagnostic, therapeutic, and allied health professionals. So your salary for community service is 233,691. Your net salary being 20,989. Grade 1, once you've completed your community service, your salary is 317,976, and your net salary being 21,016. Grade 2, after 10 years, 372,810, and your net salary being 24,194. Grade 3, your net salary is 27,961. As a chief, grade 1, your salary is 466,119 Rand, and your net salary being 29,410. As a policy developer, grade 1, and a program coordinator, you earn the same as a chief, grade 1. Assistant director at an institute or as a policy developer or program coordinator, you earn 517,326, the net salary being 32,164. If you are eligible for the allowances, if you're a speech therapist, audiologist, physiotherapist, you can earn another 3,000 at community service, or as a deputy director, about 5,000 or 6,000 more. If you're in a rural or in hospital or PSCBC, Rural Allowance Institute. Now that you know the salary, you can make a few career decisions. You should consider specializing further. There's hand therapy for occupational therapists, there's traumatology, as well as sports medicine for physiotherapists. This will give you a competitive advantage when you consider going into private practice. Private practice is an option as there are very few posts in the government sector for the allied health professionals. Marketing and social media courses, especially if you're deciding to be your own boss. As I said, if you want to go into private practice, you need to have marketing and social media skills. So I would suggest you do a course. So when you go into private practice, you're able to manage your practice. The highest earning potential is 1,121,121 rands as a deputy director. And this is excluding, of course, the rural allowances. But as a deputy director, this is the highest earning potential you can earn. So you can work your way up to a deputy director. Usually they want you to have management skills. So doing an MBA or doing an MPH will be an advantage for you. If you like what you heard today, press the like button. If you want to hear more content of this nature, press the subscribe button. And if you want to enhance your career and maybe look at moving into a management role, click on my video on the left, where I talk about the salaries of CEOs in South Africa. See you soon.